Welcome everyone to the Fayette County School Corporation School Board of Trustees special meeting. It's Thursday, September 2nd, 2021. We're here in the administration building. Let's all rise for the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, Board, I'd like to seek a motion to approve the agenda as submitted and amended.
I so move.
Thank you, Ann. A second?
I will second that.
Thank you, Chris. Any discussion? All those in favor signify by raising your hand. Opposed, same sign. Motion carries. Okay, we're going to move. Are we wanting to do the action items or public comments first?
Let's go through and share some data first.
Yeah, I think we're going to go ahead and do a little presentation, and then we can see if there's any public comments.
Okay. Good evening. I wanted to update you on our current numbers as of today. These numbers were entered as late as about an hour ago. It's quite a task on our schools to really contact trace and make calls. But something that I'm finding is our students are testing positive at a much greater number than what they were over the last school year even. So as we look at this, currently we have 13 positive staff members in the district, 74 students who have tested positive as of now. We have 80 students who are pending positive tests that we haven't gotten the results. We have 246 quarantined students and staff, and we have 580 absences today. So we're definitely feeling that with the attendance and with our cases. So we never had some of the numbers, mainly middle school and high school are getting hit the hardest, but we have had two schools in particular that have had higher numbers that have been more isolated. And something we didn't have last year was an outbreak in a classroom that we traced back. This year we've had that, and we actually had to send a class home at Frazee for 10 days because of an outbreak and spreading in that one class. So that's been unique to this year. So I wanted to share that. Any thoughts, questions on that? A lot of kids out of school.
On those quarantined, are those family, can you define
Okay,
them?
thank you. Yeah, for the quarantine students, those are where they're being contact traced back to their home or their personal lives.
Okay.
So, and we have given parents the option to, when we call them and a student's been contact traced as a close contact, the parents are given the option to quarantine the kids. And in checking with our head of nursing today, very few parents, less than 15, have chosen to do that over the first month of school. So it's not a lot are choosing the quarantine option. So we know that parents don't want their kids out for those 2-week time periods. We don't want them out. And we've tried to have that flexibility even since last spring. So but it's catching up to us some. So I wanted to share that. I also wanted to go over, I think everyone or most people have seen, the governor issued a new executive order yesterday, 21-24. So what that means is in the year 2021, this is his 24th executive order. And guess what most of them have been about? Something related to COVID. So this order is in effect through September 30th. And this really changed, I think, as we were looking at keeping our kids in school, keeping our schools open to in-person learning. And so Cindy's bringing some of these up so our patrons can view it. But if you'll go down to section 6A, that's where it really talks about our schools. So I wanted to share a few pieces. We've already been doing this. We share all of our positive numbers with the state, with the Department of Health. We enter those into the system, report those. We are doing the required contact tracing and notifying of families as required. But the governor's added a twist to this now, which changed my perspective on what we could do or what we were going to be able to do. So here's what he did. He said back in July 1st, that local control over decisions related to COVID. You all remember that local school boards and other governing bodies would have that control. So he's still maintaining that. However, he is telling us now that we have to follow the directives of state and local health orders and other local ordinances or directives, and we can't be less restrictive than what they're now saying we have to do. We can be more restrictive, so really the only control the governor is now giving schools is you can be more strict or more restrictive than what the State Department of Health is doing. So yes, you have some local control, but only if you want to be stricter than what. So just interesting. So I wanted to share that.
And what about the quarantining piece? Was that in that? Oh, is
I'm
that
going
on
to get to
for
that with you,
program?
yeah.
Okay.
So basically what the governor did is he kicked this to the State Department of Health. Is that right, Dr. White? Mm-hmm. And so if you look at the next document, Cindy's going to pull that up. The governor has now said that these control measures that the Department of Health for Indiana has put together, there are some highlighted yellow items I asked Cindy to pull up. And it talks about the whole quarantine piece. And this is, to me, the most important part of where we're at now. And so I'll read on section 6, is that where you're at? Okay, right there. For K-12 schools that have and consistently enforce a face covering requirement for children, students, teachers, and staff, and others present, close contacts are not required to quarantine and may continue to attend school as long as they are asymptomatic. The close contacts should monitor daily for symptoms of COVID-19. Any symptoms of COVID-19 must prompt immediate removal of the symptomatic individual from the environment at school. The individual should seek testing and isolate. This exception to quarantine only applies in the classroom setting and does not apply to extracurriculars, etc. So, what's happening now is if we have a masking requirement in our schools, we do not have to quarantine if the students and staff involved were wearing masks. If schools choose to not have a masking recommendation or requirement, then those students must quarantine now, the full quarantine amount, which could be up to 2 weeks. So the governor, in effect, kicked it to the State Board of Health, so he didn't put the mask mandate into place, but he put it on the shoulders of the State Board of Health, which has full authority to require this. And that's where we're at as schools. And for those of you here, you have an interest in this one way or the other. And I just want to say on record and to the board, everyone has an opinion on masks and vaccines, and that's your right. And I understand why there's so much confusion, because it's illogical with a lot of the stuff that our leaders are doing right now with this whole COVID. I mean, you have doctors on one side saying this, you have doctors on this side saying this. And we're the little guy in the middle, being put in the middle of this with the crosshairs on us as schools and our school boards. Whether you agree or disagree, it's put us in this position where we're just trying to keep our kids in school, in-person learning, and to keep them as safe as we can. And it's frustrating. And so I would ask our parents and patrons who are upset, contact our governor's office. That's a good place to start, because there are issues there where you have the state legislature waiting to file a lawsuit on the governor if he puts a mask mandate into place. And so he's not going to, so he kicks it down to the State Department of Health. And they do have the authority to put these things into place, and the governor said they do. So that's where we're at, and that's what the board needs to understand, that if we don't put a mask mandate into place, and right now the governor's order is through the end of September, then we're going to quarantine all those students who are close contact. And as of this morning, we've had over 920 close contact kids in the first 3.5 weeks of school. So about a third of our K-12 population would have been quarantined for up to 2 weeks. And some kids have been close contact traced twice, so they would have been out for the whole first month of school. So the state is giving us an out on that, and we can keep kids in school if we wear the mask. So I just wanted to be sure everybody's clear on that. That's where we're at. Any questions on this information? Next, I would like to talk about our return to school plan. This has been posted on our website, but we have some information that we have updated. We're trying to be responsive. And so I've asked Kim to go through just the highlights of this, and it'll be up on the screen if you can read that as well. And this is also on our website for reference if you want to look at it later.
Thank you, Scott. As he said, this was the original plan that we adopted at the start of school. What we have done is, after receiving the governor's mandates and the Indiana State Board of Health, we've gone back to our original plan and tried to tweak it to meet the needs of all of those mandates and try to find a balance. So what we've done is we've gone through each section. The majority of the plan is on this first page. There are some additional changes throughout, but you can see that we've made all the changes in yellow just so that you can tell what the original sentence said and now what we've revised it to say. So the very first pre-K-12 recommendations, Scott will explain to you after I'm finished talking about this, a guidance matrix that we've created to kind of give us some specific data points as to when we need to make decisions. It's hard because it changes daily, it changes hourly. So we felt like if we had a matrix with specific data points, it would be easier for us as a collective group to make better decisions for our kids. So he will go over that, but that's the very first change we made. Before, we were operating on if 10% or less of the students, and we had a low caseload, that we would do the first column. Then we had an additional column that was dark red, and that was if we had a moderate spread. But since the governor has put in his mandates, it's kind of changed that thought process. So we've taken out that third column and just reduced it to one, and then created the matrix in which he's going to explain in a few minutes. The second bullet is school status. Originally, we said we were going to do in-person learning. As you know, last year we did the virtual learning and asynchronous learning, and our kids really struggled, and we just felt like it was in their best interest to do in-person learning this year so we could get them caught back up, and we just felt like that overall, from our administrators, from our teachers, from our parents and our students, it was just a much better approach. So we'd like to continue that. However, we will continue to follow the matrix, which we will explain to you in a minute, in case we hit certain data points either in our community or in our schools, because we want to be responsive to that as well. Mask status, we would like for it to change it to say mask recommended but optional unless mandated by the state of Indiana and or the school board of trustees. Before it said masks are recommended. Now we're saying if we're not under a mandate that we would recommend them but not require them. But however, if we are placed under a mandate like we are now, or if this board chooses to put that mandate in place, we would go back to students wearing masks. Contact tracing, again, if we are wearing the mask, it changes how we contact trace. We had a flow chart that we had developed at the beginning of the year. If it was a home close contact, obviously they were quarantined. If it was a close contact at school, we were calling parents and giving parents the option to quarantine. So we had to change that language just to say that if we are under a specific mandate, that our guidelines will follow whatever that quarantine guideline is. We didn't want to put it word for word because, as you know, with COVID, it's very fluid and it changes a lot. So we felt like if we just said that we would follow all state mandates, if that would happen to change tomorrow or next week, we wouldn't have to reconvene and update our plan. The executive order is very specific with extracurricular activities. Right now, the current mandate is just requiring masks to be indoors only. So if they have outdoor extracurricular events or sporting events, they're not required. So we wanted to note that we would again follow whatever the mandates are given to us from either you guys or the governor's or office. As you kind of work through the next couple of pages, it's really just those categories, maybe a little bit more specific. So again, you will see that we talk about that isolation or that quarantine. It's the same language, we just had to change it to match the front. And then if you go to COVID monitoring, we have all been reporting to the Indiana State Department of Health. This is a time-consuming process, and I want to give a shout out to our health assistants, our nurses, and our secretaries, because they have been working tirelessly to try to get this information in. And we recognize the value of this information, but I was at Eastview yesterday and I called 14 parents and it took forever. And I know middle school and high school have a whole lot more students and parents that they're contact tracing than our elementaries are. So I just want to make sure that they recognize that we recognize their hard work. Face coverings, again, the Indiana Department of Health has mandated on September 1st, requires all individuals to wear face coverings when indoors to avoid required close contact quarantining, so we changed that. If you go to the next page, we started off the school year. Last year we were able to change out the majority of our water fountains. We had the old-fashioned water fountains, and we were able to use some of our CARES Act money to replace them all with the bottle fillers, but they still do have like a small water spout where kids can get a drink. We had those open, but due to the increase in our caseload at our schools, we will shut those down. We'll have the bottle fillers for them to continue to fill the bottles, but not be able to put their mouth on the spout or close to it. So.
And we did order enough of the new fountains with the bottle fillers back in April, but they're still on that ship from China or somewhere, so we haven't gotten them. But we do have enough order to replace the remaining water fountains. So
but there are a couple in each building.
Elementary,
yeah, there are a couple in each building. We would like to have more, but so we have put in there that water fountains will not be utilized whenever we are considered a substantial spread or a high to moderate spread in our community or within a school. So that could change one school. We have some schools that are doing very well, and we have other schools who have a lot. So we just wanted to make sure we made sure that language was in there as well. The last part, really, the changes, transportation hasn't changed, but when you go down to athletics, right now we're going to just add in another sentence there at the end, that we will follow any state requirements as mandated by the state of Indiana or the IHSAA. Both of those are governing bodies that could put something in place and we might have to change, and we just felt like it would be to our advantage to go ahead and put that in there. As we start to move from fall sports to winter sports, things could change very quickly. And then also extracurricular activities, same thing, any state requirements that are mandated towards us by Indiana or the Indiana Department of Ed or this board, we will make sure that we implement with fidelity. So that's really the changes that we made to the original plan that we adopted at the beginning of school. So this is what we felt would help us be in better compliance with the mandates that were put down yesterday evening. Are there any questions or comments about anything that we have written in there?
The only question I have is you used the phrase, I don't remember what it was, but you know, moderate spread or whatever when you were talking about the water fountains.
Right.
So are we going to follow, I mean, what is what schools would have that fountain available?
Well, and I think once Scott explains the matrix,
yeah,
it'll give the community and teachers and administrators as you as well a little better understanding of where we're dividing, where are those tipping points.
Right. Right now, do we have any of the mouth fountain parts open?
We do not as of, well, we could
did
today.
start the year, but
we
we're closing
could.
those back down.
Yeah.
Okay.
Most of the kids honestly are using water bottles.
Yeah.
We provided water bottles to all the kids last year. We still have some here that we've given out. A lot of kids like to have their own fancy one, and they bring those. But the fountains were open at the beginning of the school year.
Okay.
Yeah.
So next, something that it still was a work in progress until this morning, but it's just a way, when you reach that point, and so for example, one of our elementaries, when we had 4 students test positive in a 2 or 3 day period, then we had 6, there were 6 of them. And then we realized, wow, you know, we've got kids who were showing symptoms, waiting on test results. At that point, I made the call to go ahead and close that classroom to in-person learning until today. They returned today. That was reacted to that. We weren't seeing the spread like that in any of the other classrooms. So it's a big decision. You're impacting lives, especially elementary, because that puts a burden on our parents too, because you have to scramble to find, oh, what am I going to do with my kiddo? These were 6th graders, so they were 6th grade's a different beast to deal with than 1st grade or kindergarten, but still, it impacts you. So this is a matrix, I would call it, some guidelines that helps us be consistent. And so parents know, so our teachers know, our principals know when we reach these points. So when we look at our positive COVID rates in our buildings, we're really looking for what point do we think, okay, we've got to take some extra steps. And so when we look at, if there's a 5% positivity rate in that building. So for example, high school has a little over 1,000 kids. So if we have over 50 kids hitting that positive rate at one time, the first level of that is putting masks in place as a requirement for 10 days to give it a 2-week period to try to work through that. Now that may change depending on what the board decides here with the mask piece based on what the governor and the Department of Health has done at the state level, but that would be our first level. The second, if we reach a 10% positivity rate with students and staff, then we would move to a hybrid instructional model. And that's a model where we had to use it at the high school 2 or 3 times, I think, Randy, last year, where we create a schedule where half the kids attend each day and the other kids are doing online. We don't want to do that, but that's better than moving kids totally online. So if we had 10% or more, so for Mr. Judd's building, we would have to hit that 100 number, 100 students and staff. That's a lot. But that's where we're at with that. And then to move to an online learning model, which would be full 100% online with no students in the building, we would have to be at 20% or more. So that's a lot of kids. At an elementary with 300 kids, that's 60 kids and staff members. And I did share this with Dr. White, with our health department, and you looked over and gave me some feedback as well. And then we also added a part in the middle of that in italics, just for a classroom situation. And we're using 20%. So if we have a class of 25 kids, when we get to that 5 kids with positive cases, we will move that class only to an online learning model. Then the other part at the lower half, it's for our district-wide guidelines for the positive rates. And we really will rely on using the data that the Department of Health publishes every day. But every Wednesday, they give us our new rating. And so I think, Dr. Wright, we're 2.5 on a scale of 3.
We'll probably be red next week.
We thought we'd be red this week, though.
Look at that now.
But when you look at that 7-day positivity rate, I know this Wednesday, we were at 11.09. So when we hit a 20% for the county, we would move to a hybrid model for 10 days, 10 calendar days. If we reach 25%, we would move to district-wide online learning. So this gives us some data points to work with. So I don't know if you had any other thoughts.
And I think that works well with what the mandate is saying.
Right.
You wear your mask and you do behave yourself. That you can get we're quarantining and keeping everybody in school, and I think the whole idea is to try to suppress the spread. And I can show you studies that masking, social distancing, hand washing don't do a daggone thing, and I can show you an equal stack of studies that say that's the only way we're going to save the planet. Somewhere in between is where we need to be. And our county is in since last summer has done fairly well. And we're kind of like, I don't know, Matt has the better numbers, but we have about a 50% vaccination rate in this county. And I showed you folks some data there that showed all the states that had highest vaccination rates don't have any Delta virus. It's the most contagious virus known to man right now. If you'll look in that one, it's almost as contagious as measles and chickenpox. Not quite as deadly, but it's very contagious. One case can infect 5 to 10 other people. And so that's why it's spreading like wildfire through the unvaccinated. So, that's the one thing I want to come away with tonight is everyone needs to get vaccinated. Eradicated polio and smallpox and tetanus, and there's nothing wrong with getting vaccinated. And as soon as we do, we'll achieve the 80% herd immunity, and this whole problem will go away. I don't think it ever will until everybody gets vaccinated.
Can I ask a question? I know the patrons didn't get a chance to get this, and I don't think Cindy had a chance to have it on her thing, but this is basically, you gave us examples of, and I'm glad to,
The highest and lowest states.
I'm glad to put one out there, and you guys, that's only
Yeah, they
one.
can.
Pass it
It's
around.
just evidence right now that
So
shows
could you explain, because I needed a little help and it's kind of fuzzy. On the first page, of course, those are states with high vaccination rates, right? And I apologize, there's only one. If anybody else wants to give theirs up and share, then people can see these. What are the three? So like on the first one, it said Connecticut, and there's 3 graphs. What are we looking at?
Oh, I see. Well,
I'm just trying, really what we're looking at is a comparison of that page to the next page.
it's just showing the invasion of the Delta variant in these
Okay.
communities. And once they're highly vaccinated, the hospital, they do get infected, and it can infect you even if you've been vaccinated, but you won't go to the hospital and you won't be die.
Right.
The infection rate's only about an 8-fold decrease, but it's a 25-fold decrease in the number of hospitalizations and deaths. That's
So
the
when
part.
we look at, for instance, under Connecticut, I'm asking more for my own information, this may not concern people, but I just like to know what I'm reading. You have that blue, then there's the second of the 1, 2, 3, that's kind of got that olive, and then there's the gray.
Right.
And you're saying hospitalizations per 100,000 residents in the gray are only, what does that graph mean? That's
Okay,
what
you can see the trend is down on hospitalizations on the highly vaccinated states. 62% in Connecticut, 63 in Maine, 67 in Vermont. Then you go to the lowest vaccinated states, which are like Alabama has 34, Arkansas 35. They all have an uptrend in the hospital cases going in. And
Oh, okay, on the right side is the
Right.
entrance, okay.
and again, it's kind of a hard thing. The point is that vaccinations make a big difference in this Delta variant.
Okay.
You're going to get it, you'll probably get infected with it, but it won't be near as deadly.
Okay.
And this one graph I showed you here, where the vaccinated people, for disease incidence, you have an 8-fold reduction if you're vaccinated. But if you're for hospitalization, it's a 25-fold reduction. You're 25 times less chance going in the hospital, and for death too. But like I said, the only way we're going to win this battle is to get people vaccinated and understand that that's going to curb the pandemic. And keep everybody in school and football games and.
So how is Reed, can you share how Reed's
Yeah,
numbers are?
I just talked to Dr. Huth right before this meeting, and I didn't get a chance to print that out, but he said that there are currently 58 people that have COVID in the hospital. Now, to me, that doesn't sound like a lot. One is 15 years old, but had a risk factor of severe morbid obesity, BMI was over 70, that's huge. And the next youngest was 21, and everyone else is above 30. The youngest vet patient is 33 years old, and the in-school masking topic, he says that last week, today's study of morbidity and mortality weekly report shows a case where one teacher infected three-quarters of the classroom, and she only taught one day. They didn't have masks. That happened in Marion County, California. And it was all Delta variant, So that's why it's so scary that if we don't have a mask indoors when everybody's talking in front, the kids take it home and spread it to the other vulnerable people. So
How do they know it's a Delta variant?
That was the study we looked at, that's when they first started talking about the Delta variant, back in May. This happened in May, the cases they're talking about. And that's when they realized how contagious it was.
When we do testing, when it's sent away to be tested, they will check to see what variant it is when we do tests.
Test, can diagnose that?
They can tell you what variant it is, yeah.
Is that
How do they know
something new?
what variant it is if it hasn't been isolated though?
I don't know, what do you mean they have devices?
If the virus has not been isolated,
So they isolated.
they did, from what?
The swab.
An animal? What's it isolated from? A swab? The PCR test swab?
Huh?
The one that gives 90% false positives?
We're not seeing that.
We're not seeing 90% false positives.
Of course, you're all gonna disagree with it.
CDC
That's
says you can't tell them to that before you guys.
I mean, there's counterpoints to everything you're saying. I mean,
That's on their website.
we're sitting here being polite.
I mean,
And we appreciate that.
Yeah, we do.
I don't completely understand your point.
I don't understand yours. There you go. We're on the same boat.
Sounds like you're up here trying to sell vaccines.
It doesn't it?
We are,
Vaccine
we believe that the vaccines are beneficial.
So I guess,
So can we expect to see a mandate for our
We
children?
don't do mandates, we're just telling them.
We're just-
Just mask recommended. Gotcha.
You do what you want.
Well, do masks actually work?
No.
What's the filtration rate
Yes.
on those masks you're wearing?
If you wear an N95 mask that's fitted to your face,
N95 mask might work.
N95, yes, those are fitted to your face.
What's the size of a virus particle?
Lot smaller than the holes in your mask.
Yep, even Fauci said that.
okay,
Thousands times
can we, okay, so this right here,
It's where we're at.
we've all been put in, I'm not a doctor, I'm an educator, I was a teacher. And so, I get it. I have family members on both sides of this. I mean, I question the same things, and I think many of the people around this table have. We are not the professional. You know, I have leaned on Dr. White a lot, and he's been very good on helping us keep our schools open, very practical. You know, we didn't move to the, you know, we didn't have to do masks. You know, he supported that, and Matt did. But this isn't really that debate, just not to cut you off, but we need to keep the focus on this, because this is what I hear every day, wherever I go. I'm not a doctor. I don't have the answers, and you don't have the answers. No one, I mean, we hear both sides, so we've got to trust the best thing we can do for our kids.
Does anyone have a study showing that those surgical masks or cloth masks don't work, that they work? Does any of you have a study on that?
I have 10 studies that say it doesn't.
Yes.
Yeah, I mean,
So listen, my daughter has anxiety. This is her first time ever in public school. She's not gonna wear a mask. I mean, I'll pull her right back out. She cannot wear a mask. She
Well,
has
we'll have an
anxiety.
opportunity for public comment. If you filled out a form, we'd be glad to, but we're gonna try to stay on task here and keep rolling. So if you want to fill out a form, they're right outside. You're welcome to grab one and just turn it in real
That's
quickly,
why
so.
we don't mandate our masks for our kids.
So is there anything else from the health department that you wanted to add before we move on to the board discussion?
No, I think you spelled it out to the T, to what position we're in.
So I turn over, we have some public comments, I believe. So I
We
think
do,
we're-
but do we want to have, but do we want to first, it's kind of up to the board. We can discuss a little bit, open up public comments, then further discuss and discuss the COVID plan, or do you want to just go first and hear the public comments? It's all up to you guys. First, before we do the discussion. Okay, so we have two people that asked to speak. Monica Brown is first, and if you wouldn't mind coming up to the podium and stating your name and your address.
I really didn't know what I wanted to speak on, I was just kind of. First of all, I want to tell you guys, well, I'm Monica Brown. I live at 2016 South County Road, just down the road here. Obviously, I'm a nurse at Hancock Health. But first of all, I want to tell you guys, thank you for keeping the schools open. I really appreciate Mr. Judd last year, 2020, because my oldest son had to go through this whole, like, we didn't know we were gonna have prom, we didn't know. So here we are, 2022, and Gage is starting to suffer the same things. So, so I guess my concern as a mom, one, I really don't want my kid learning at home. All three of my kids, my daughter was in college freshman year, Jake's senior, Gage is freshman. Or sophomore, and they will all tell you to learn online is terrible. Jake was doing college comp with Miss Shouts. Here she's trying to do Zoom with him, with how many other kids in our kitchen, our internet's terrible. Gage is in college comp this year, so I can only imagine like how it's gonna be again. Do I want Gage to wear a mask? Absolutely not. That's just my personal opinion. I don't feel like he needs to wear one. But if that means to keep him in school in person, I'm willing to do that. I asked him right now at the soccer game before I came, what do you want me to say? Mom, I really just don't want to not do e-learning. I don't care what I have to do. It really doesn't matter to me. I really don't want to wear a mask, but if I have to, I have to. As far as, we can argue about vaccinations, not vaccinations. We haven't really talked about positive antibodies, because that's a whole new natural immunity. They're shown as more effective than 2 doses of vaccines. That's from the Tel Aviv University in Israel. So we can go back and forth on that all day. But the main point is our kids. That's the whole point right now, is keeping our kids in school. So me, as a parent, I'm just asking that you keep them in school. If they have to wear a mask, so be it. I don't know if they can put it under their nose, however, they're wearing a mask. Put it on their head, however they want to do it. But, I'm just asking, no e-learning, because it is terrible on them. How much are they really learning? Honest to Jesus, if you really want to talk about it, how much are they really learning? Because, they can call up their best friend and be like, hey, what did you do, da-da-da-da. They can't go to their teacher and say, I don't understand this, And like I said, when Jake had Miss Shouts, she's a lovely teacher and he absolutely loves her. And she was so vibrant on those Zoom calls. But to have that same interaction, he didn't have that. So I just really feel like we really need to keep them in school. I'm not against the hybrid learning. I still don't like it. But I just feel like they need to stay in school. I just don't feel like we are helping them in any way, shape, or form by e-learning. I just don't feel like they can really, my kids can anyway. Now, there's some kids that can, but my kids can't. They just don't feel like they're getting the same education. I don't feel like they're getting the same education. So, with saying all that, a friend of mine, I only have 5 minutes, but she sent this to me today, and I don't know how this is any different, because I guess it was August 31st, and it's kind of blurry, but it's kind of what Decatur County community schools are doing. So I was kind of listening to what you said about the governor, so I'm thinking, obviously Decatur County is under the governor just as much as we are. So
It just came out yesterday, so.
Oh, okay, so that's what I wanted to know. This was August 31st that
Well,
she.
They're
This just
having
came
their
out
board
last night.
meetings too.
Okay, well then I won't mention what it says on here then, because I'm like,
I've already seen it.
okay, all right. Because I'm like, well, okay, I'll take that. But I guess, again, as a parent, I just want to say
How
that,
fluid this thing is.
right.
I had shared something like that with the board just the other day.
We got it and then like, oops, governor changed his mind and
Well, the Department of Health.
Department of Health.
Well, everybody seems to be wishy-washy right now. I mean,
Right.
just in
Yeah.
general. But I'm
Well-
just saying, as a parent of a senior, I've already been through it once, I had my cousin call me today, and his kid's a junior, and he's like, ever since he's been in high school, we've done COVID, and I'm just asking that we keep our kids in school. E-learning does not do them any justice whatsoever, and that's all I'm asking. Now, like I said, I'm not crazy about the mask, but if that's what it takes, I'm not crazy about it, but to keep him in school, I'm okay with that for the moment, but it's till the end of September, right? So supposedly.
So far.
Yeah, so, whatever, but that's all I really want to say. So I was just off the fly.
Next person, Melissa Rose.
Hi, thank you guys all for your time and
Keep in
everything
mind,
you do
you've
for
got
the kids.
3 to 5 minutes.
Okay, absolutely. Yeah, I was trying to prepare something and I have, years before this all started, I've just gotten really into scientific studies about everything, just improving health and fitness. I'm really passionate about it all around. I just want to make my life and my family's life as good as possible, and, help share information where it can help others, encourage them where they're trying to make positive health decisions. That's why, all of this I feel like is really upsetting when they're taking the power out of our hands. Like, I feel like we have to stand our ground where if we feel extreme strong conviction that something is not healthy for our child, that in fact it's abusive, like, keeping them from breathing optimal oxygen by wearing a mask. And I don't think that we should have to have a medical exemption from a doctor when there's information that we can gather from doctors and scientists to make our own decision as parents and follow the peace, God gives us about making decisions. That should be important. And I think that we should be able to, if a mask mandate is handed down, or vaccine mandates, or whatever that may be that we feel goes against our kids' best health interests, that we should be able to, exercise our legal authority as parents, just like I had to say whether my child could use Tums or ibuprofen or cough drops that the school gives them. Why would I have to sign something like that and even have a discussion about, I understand it's not you guys the ones pushing it down, but, they're just taking that power from us if we think that mask is dangerous for our kid. And I'm thankful that we live in Indiana right now, in Connersville, as opposed to California or New York or some of these other places I wouldn't be able to stay. And I'm just hoping that we can make this place representative of the people that I believe live here, that want personal freedoms and want to respect people who completely disagree with me and their option to get a vaccine or wear a mask or whatever it may be. But I did write down a few things that, I believe that studies show that they have increased of bacterial infection, especially with kids touching their masks all day, and they're not going to be replacing them several times like I would if I've had to wear one in a setting, keep it in a Ziploc baggie when I'm not wearing it, things like that. I just feel like kids aren't responsible or able to keep their mask clean enough to where it's not going to cause more bacteria on their faces and trapping viral particles. I've seen studies like that they're not able to expel as much and also not able to get as much oxygen. And I will get an email. Scott Collins said he could send one to the board members if I would do a group email, and I would just like to attach all kinds of studies that I feel have been important. And I think it's good that you are able to share your information. I do find it really frustrating that doctors that disagree and believe vaccines have really strong inherent risk, and we should be wary about promoting them. Doctors that are really all about lifestyle, eating proper food, supplementation, exercise, that's what's going to get us out of this, and that's just being shut down. I think you guys all know that. Like, the opposition is just being completely shut down from, I got myself off of social media a long time ago because it's not even, I can't promote, those companies. But the Journal of the American Medical Association in 2020 listed heart disease as the number one cause of death, followed by cancer, followed by number 3, they said, was COVID-19, although clearly on their website, I was there again today, it states that only 5% of deaths recorded for COVID only had a COVID as the cause. The other had an average of 4 other causes of death listed, other comorbidities that we all know about, which are preventable, and we have not. The federal government, the state governments, no one is just screaming, let's start a war on heart disease. I was looking at the food that, I've believed for a long time that school lunches really need an overhaul, and Mr. Collins said that the high school had actually gotten an overhaul recently, or like in the last several years, right, about having more healthy options. But I just went on today to see, okay, let's see what they have at Fayette Central School locally for breakfast. It's like there's a Trix bar, just the grams of sugar in these things. I was getting upset just looking at it. I knew that I would. The lack of protein. They're giving skim chocolate milk with 20 grams of sugar. These are like small children, and the grams of sugar per day that are available in school meals is just, I know it's not maybe necessarily what you're discussing today, but I don't know who's in charge of, changing some of these things. Like, let's give them whole milk and not have Cinnamon Toast Crunch Bar with 65 grams of carbs. That was one. I think you guys all probably understand where I'm coming from with that like we need to attack this and all other viruses and all other health issues. I am glad that there's more public awareness about health, like washing hands, like wiping off cell phones. And I would love if, I don't know if the health department could distribute vitamin D, or if there's like money we could raise to help pay for that, or, you know, what capacity that the health department could be in to like help people supplement like vitamin C and vitamin D, and just, yeah, well, like, you know, hey, stop by the health department, you get a free bottle or something like that. I don't know how it would work, but just that things would be discussed that are alternates to this, and I feel like it would empower me and other parents, or make us feel heard. If the school's saying, you know, our hands are tied, we have to do this thing, like, let's also do all these other things that cannot just be blind and say COVID-19 is the only, you know, danger to our kids and our health, and the only thing is vaccines, and the only thing is masks that's going to help it, when there's not studies behind that. I feel that are inconclusive. I feel it is inconclusive that exercise is, you know, it's even helping people to respond better to vaccines when they get them, from what I saw. It's like people that are healthier respond better to any type of vaccine. So yeah, I'll just let you guys, like I say, I have a lot of notes, so.
Thank you.
Thank you for your time.
Thank you. Appreciate that. Stacy Fee.
Hello, my name is Stacy Fee. Hi. I'm a nurse practitioner with the urgent care here in town, and I don't have any statistics for you. I'm not here to push the vaccine. I feel like it's everybody's choice, but I'm here to tell you what I've seen, and I've been on the front line since March of 2020, since the beginning. We did close our respiratory clinic down briefly last summer because there was not a surge here, just like this summer, and we reopened at the beginning of September last year. Volumes were high, maybe 60s a day. Rarely did we see a child with COVID. Maybe high school, hardly any elementary or junior high. And I'm just telling you that's what I've seen. I don't know the statistics actually, but I'm just telling you what I see here locally. This year, when school opened up, we have been at least 3 or 4 weeks now overwhelmed with our patient volumes. We're seeing close to 100 a day over there. So what's different this year? No masks. There is a new Delta variant as well, though, that is more contagious. We're seeing strep again. We did not see hardly any strep at the beginning of last year. All of the providers were like, you know, where's the strep throat? Where's the hand, foot, mouth? Where's the RSV? It's all back this year. So just from my observation, from last year to this year, I'm seeing overwhelming more numbers since masks were taken away. I agree with Monica, though. I don't think kids need to be out of school. They definitely need to be in school. My daughter's a teacher. She does not want them out of school either. But, you know, the rate of the spread right now, I do like the idea, you know, knowing if it's in a classroom, at least shutting it down. I don't want them to wear masks the rest of their lives either, or the rest of the school year, but while we're surging, you know, 2 or 3 weeks of wearing a mask, if that cuts it down, I mean, I think that would be helpful. Also, and like I said, I'm not here to push the vaccine, but just what I've seen with the positive patients I've seen now, I think I've had 2 positive that had the vaccine. The majority are all unimmunized. So I even reached out to Dr. White last week to see what are we doing, because you know I feel like this meeting is a couple weeks too late, because we're probably not going to flatten the curve now. I feel like we're at the top of the curve. So, any questions for me?
You say that is about 100?
We're seeing 100 patients a day. That's not all positive COVID.
Okay.
And that's another thing too. I fear for the other ill people that are truly sick that need to be seen. We have 2 and 3 hour waits over there to be seen. And I feel like the sickest of the sick can't wait, you know. And then the majority are children that, you know, parents are wanting them tested. And so they're able to wait because they're not that ill. And I will say most kids that get the COVID are really not that ill with it. Like the adults were last year that required hospitalization.
Stacy, besides strep, what were your flu numbers last year?
I saw 1 positive flu patient last year. And another provider I worked with not too long ago, I asked her, I said, how many flu did you see last year? 0. So
I saw somewhere.
I feel like that's going to be on the rise again too. And that covers all ages, you know.
I saw somewhere last year where we went from nationwide 4 million cases
Yeah.
of the flu
Yeah.
to about 40,000
So what was different than last year? The
masks.
masking.
And people didn't go out. We were basically.
Right, and I don't think I don't want everything shut down again. We've got to live, and kids have to be in school. I totally believe that. But, when we're surging, let's just be a little more protective and, do the masks for, a brief period anyway. I know strep's never gonna go away, all the other things are never gonna go away. But,
Ma'am, are they confusing RSV with COVID
no,
for the kids?
we have 2 separate tests for that.
Okay.
Yes. And I will say, we don't test a lot for RSV, like over probably age 5 or more. Because RSV, like adults, we can all get RSV, it's just a common cold for us. When we test for it, it's in younger children because that's where they can get in respiratory distress and it can cause complications and they can get very sick. So it's a very serious virus in the younger population. But so having said that, so we're testing, the younger population for RSV and COVID. But, the school age and higher, we're testing COVID. So we do know the difference when we're doing that test.
I'm glad you do, because sometimes I feel the news media don't.
Yeah.
They put it all as COVID
And also,
instead of
I'd like to throw this out there, that Reed is having us, and you're not gonna like to hear this, any kid with any symptom, despite their, despite their testing result, they are wanting us to do a 10-day isolation for them. And that just kills me to have to do that and a lot come in with hours of symptoms, My kid woke up with a cough, we're here, or they started during the night, and I tell them too that COVID testing, the rapid may not be as accurate when you're less than 12 hours in symptoms. But it kills me to have to tell people, the 10-day isolation, I don't think they need to probably be out of school that whole 10-day. Or people with at work, they can't afford to be out of work 10 days, so that's not my rule.
Clear, Stacy?
Yeah, the
You're saying
isolation.
any kind of what?
Upper respiratory.
So if you have a headache and you're there to be seen and we do COVID testing, if you have nausea, if you have a sinus symptoms, anything upper respiratory, even if you test negative, even if you're vaccinated, they're having us do a 10-day isolation from the onset of symptoms. So if they come to us on day...
You're recommending a 10-day isolation?
Yes, that's what, when they say, well, we need a note for school, we put the note 10 days out from when their symptoms began. So they could have been sick for 5 days, they get 5 more days isolation. But if they come...
Did Reed state why they're doing such?
That's the incident command that has decided that.
So we can't have allergies anymore?
Correct.
Nope, you're isolated.
That's correct, and so that's making my job really hard too.
Oh, yeah, that would be. And also, it would be, to my mind, that would be a deterrent for somebody that has allergies and just is feeling kind of puny
Yes.
for a day.
Absolutely.
Because somebody mowed their yard.
Mhm.
Yeah.
Yeah.
Ragweed was really bad.
Ragweed's really
Yeah.
bad this year, yeah.
What is Rushville's hospital policy, see on that same thing?
I'm not sure about
Okay.
Rushville.
I was just curious.
I don't-
It might be quite different.
Can I say, you said we haven't had a whole lot of kids.
Yeah.
I will just tell you.
Wait, you have a whole house?
Like a whole lot of kids testing positive, like last year.
Oh,
or
uh-huh.
this year.
Okay.
So I went ahead and did an antibody test. I was positive for COVID back in August 6th of last year. So I just went because I was tired of hearing all the hoopla. So in July of this year, I still have positive antibodies. So I decided to go ahead and get the rest of my family tested, which we found out later that Jacob was the one that probably gave it to us, that they didn't really have any symptoms.
Yeah.
So 4 of our 5 members of our family have positive antibodies. Now, my husband he doesn't have positive antibodies. He was obviously around me, who had like every symptom of COVID you
Yeah.
could possibly imagine, around Jacob and Gage, who really didn't know they had COVID.
Yeah.
And my daughter was up in Kokomo. Jake had stopped at her house on the way home, and she came down with COVID. But with saying all of that, I'm not going to get in a big, whatever, but, my husband was taking D, zinc, and C, and he still continues to take that. But how can he be, in my head, I'm like, he's in a house full of me and 2 boys
Yeah.
who,
I also, do you know which antibodies you tested positive for? Because there's a test for
They
recent infection and that you've had the infection, a past infection, just like mono. If you've had mono ever, you're going to test positive for an antibody that you've had it in the past.
well, I had antibody tests
done March of 2020, because our hospital paid for it for free, the same antibody test, I was negative. I took the same antibody test, now I'm positive. So,
So you've had it, but you were just
Yeah,
asymptomatic?
your IgG probably.
Yeah,
do I?
your
They will
IgG
make it.
was positive.
So that's, so what I'm saying is like, there may be more of our kids that maybe are carrying.
Well, that's true too.
You know,
Yeah.
that you know they were
Yes.
positive last year.
Yes.
You know, and they might be carrying around antibodies, we don't know it.
Right.
You know, and, yeah, it was a surge,
Right.
maybe the new variant or whatever,
Yeah.
we're starting to see more. But I just wanted to throw that in
Yeah.
there because I just thought that was very interesting, like.
Yeah. And our testing too, I will say, I think it was maybe end of September, beginning of October, where we got the rapid tests. So we were doing send-outs, and so there wasn't as much testing last year, really, as there are now. So numbers may have been higher last year too that we didn't know about because our testing has changed too. But the pediatric population, I still feel was, way lower last year than it has been this year.
Right.
Well, thank you,
So,
Stacy.
thank you. Uh-huh.
All right, that's the end of our comments that people filled papers out for. So now it's our opportunity, just as a board, to have our own discussion. So, I don't know if anybody wants to begin anywhere. Do you have thoughts? Did you want to talk about I think the main thing we're really focused on is the COVID-19 plan. What I'm looking at is the COVID-19 plan in alignment with the Indiana Department of Health information that came out yesterday. So, does anybody have things they want to discuss about it?
I'll start. I think with the governor's revelations yesterday, the best way to keep kids in school is to go back to the masking till September the 30th. I don't like masks, nobody does that I know of, but to prevent us from having kids out of school versus in school, to me, that's the bottom line. We need to keep kids in school.
If the governor doesn't renew that, or I don't know if it's the governor or the Department of Health.
The governor has the executive order that runs through September 30th.
Okay. So if the governor doesn't renew that, are you wanting then to default to our COVID,
Our new plan.
yeah, I can't find
Yeah.
that grid. The matrix.
Matrix.
Yeah, that's what you would want to resort to then.
Sure.
Unless if the mandate is continued, or the health department mandate is continued, then.
Well, just the idea that we're going to automatically have to quarantine kids if we don't wear masks.
Right.
Therefore, kids are going to be out of school.
Have we had any sports teams that have been quarantined this year?
We've had one middle school team that just is now
Just is,
because
yeah.
they had, middle school.
And what did we have last year? When we quarantined everybody? Did we?
We had a couple,
Did we have, we had lots of shortened seasons.
Yeah, the swim team,
swim team and another team. I believe there were 2 teams last spring that were.
But we didn't have the outbreak of positive cases, it was just the close contact.
And we had there were other schools that were quarantined, so we lost games and things
we
like
lost
that. From
the
that.
ability to do
Okay.
that.
I just want to clarify that. Other people, anybody want to speak?
I agree with Monica. I don't like masks either. I have asthma, and I'm old. And it's hard for me to breathe through a mask, and I don't like them as a teacher. I want to see that kid's face. I want to see, you can see their eyes. I want to see that kid's face. I want to see what's going on in it. No, I don't like them. But to me, it's a small price to pay because e-learning does not work for so many kids. And I think the negative effect that we are going to have to live with for an extended period of time on those kids, that they're behind academically, they're having social issues, the depression, anxiety issues are huge. It's overwhelming. Don't like it, but I think the governor I like the fact that we have a specific time frame. It's not like you're gonna be out there, but have to wear this mask forever. It's giving us a segment of time to try to get this virus back under better control. It's always gonna be around. We've had coronaviruses forever. I taught at the middle school for 30 years. I was exposed to every virus probably that known to man that went through the, Dr. White was my doctor, he knows. Yeah, I mean, really, we're not gonna make these things go away. We have to learn how to manage them. And some people aren't gonna manage them. On a very personal level, I lost one of my very, very, very best friends from over almost 60 years last weekend to COVID. Unfortunately, he lived in West Palm Beach, Florida. And he was not even 73 years old, and he died of COVID. Not because of what he was doing, but because of what the people around him refused to do. And if it takes a mask, which I don't like, to keep the kids at school, I don't know if it's effective or not, but if it's something we can do. We can let our sports teams play, we can go to things, we can have a semi-normal type situation. It's not ideal. There's no easy answers for this, guys. None. It's difficult for everybody. But as a teacher, as an educator, my heart broke last year. It broke for the seniors of 2020. It broke when I watched the faces of the kids at graduation this year when they were told they could take off their mask. I want to see that again with the kids that we have now. We all care about our kids. We don't want anybody sick, but we can't control all that. We can only do the best that we do with the information that we have. And not all of it is probably valid to a lot of people, and that's fine. We can agree to disagree. But we have to look at trying to make life as normal as possible for our kids. Keep them in school, do the best that we can do, and pray a lot that it works, because we don't know if it will. But we have to do what we think is the best interest of our kids. And you know, after being a teacher in this system for 30 some odd years, I cry a lot over what I see. And I see the kids at athletic events, and they're so happy to be participating again, and have people in the stands. It sounds like a little thing, but to those kids, it's not. It's not. So we'll do what, I'll vote to do what we need to do to keep it as normal as possible. It's gonna be like it was before, no. But I think we owe it to our kids to try to keep it as normal as possible, whatever that new normal is.
Thanks, Ann. Is there anybody else that wants to speak?
And I totally agree with that. We do not live in a perfect world. There's so many unknowns that we can't control. We all wear seatbelts to protect us in that car for the unknown. Many of you at work, we wear earplugs, safety glasses, hard hats, safety boots. Does anybody want to wear these things? No. But what can happen? It's the unknown. And we know wearing masks will help to stop the spread of this virus. We don't want our precious children to come down and get sick and horrible things happen. We need to be thankful that we care enough about these kids that we want them to stay as safe as possible. We want them to learn. That is our job, to let them learn and keep them safe while they are, in school. So we just need to look at this differently and just all work together on this. No one wants to wear a mask. But I asked a little elementary student the other day, I said, what would you rather? Would you want to wear a mask to school, or would you want to go to e-learning if it went to that? Instantly, oh, I want to go to school, I want to go to school. I will wear a mask. Oh, my friend, and was naming all these names. Oh, we don't want to stay out of school. I mean, it breaks my heart to think of that. So a mask is a small, price to pay or inconvenience, for these kids. And kids will adapt. We get used to things, and it's not forever. That's the thing. And if we can control it, let's try to keep it down, the numbers down, so they can stay in class. That's all we want, because we care about all the kids. So we just need to work together on this. And
think of things differently and work together and just be thankful it's not as bad here as it is in other areas. So.
Others?
Early on, I was asked my opinion by some friends of mine of what I thought, and this was before all of this come out. And I was honest with them. Some people weren't very happy with what I had to say, but I do and will continue to believe and feel that it's, the parents' right to be able to decide. When I see this, I understand that we want to keep the kids in school, and if it takes a mask to do that, and that's what we have to do, and we keep them in there. I may not agree 100%, but if that's what we got to do, that's what we got to do. But I still, and I will stand by that, the parents are parents for a reason. And if they make that decision for them not to, then, they know what that could lead up to, and they know what that could cause with their children. But I do want to see them stay in school. I may not agree 100%, but, we got to do what we got to do, so.
Jeremy and Chris, you guys want to speak?
Parents, I am definitely an anti-masker. I'm probably one of the strongest. You cannot convince me that this disease is not mainly political. I think politics have played a lot in this disease. You can't convince me it doesn't. It's kind of funny because up to this point, you've seen sides where the same side that said, the government cannot dictate what a woman does with her body as far as abortion, that same side has turned around and said, but we can make the government mask our kids or mandate a vaccine. It's hypocritical. I had my mind made up, when I came here. What the governor did, if I listen to it right now, if they're all asymptomatic, I can get 246 more kids back in school. If they're all asymptomatic, if I'm reading this right. I'm going to do anything I can to get the kids back. I'm not happy, like I said, with this, even temporarily, but I think you put me here to make an atmosphere, to put it, to keep our schools open and to put as many kids in the seats. So I'm inclined to go with this mask mandate for now. We went back to it at work. As most of you know, I work for the Marshal Service, and I screamed a fit when we went back to mandatory masks. Matter of fact, I've been talked to by my supervisor because I don't wear my mask right, as part of my protest.
You?
Oh,
wow.
Oh, yeah. Been told I have an attitude problem, but
I think you were also the one that told me what speed limit I could go and get away with it. But
well, yeah,
that's for another time.
But if I can get, parents, if I can get 246 possibly quarantined students back in the classroom and keep the schools open, I will vote for the mask mandate. I just, that's where I stand.
Thank you, Chris.
I'm the newest board member here, so somebody may know me, some may not. I'm like Chris, I'm very anti-mask. I'm also a big believer in your body, your choice. I'm also a huge believer in the natural health. I'm already getting married to one of you type that, this is what you get to eat tonight, So, love her to death, but, that's the way it is. I also, like Chris, I think we're in a bad situation in this country right now where it's gotten so politically out of control that they're bullying all sides of this country, every person, just creating nonstop stir in the pot situations. And I also, as Dr. White has pointed out, and some of the others, there's two sides to every story. There's two different studies for every way you want to look at it. It's a shame that politics has interfered with science, in my opinion. It's also a shame that corporate greed has interfered with science at times. You can go out there and look for yourself. Almost all three of the vaccine companies have all been in massive lawsuits and paid massive fines over the years for stuff that they shoved down people's throat. And well, you know, I made $1. Sorry, they didn't live. So I'm a big believer in that. I'm also, though, a big believer, coming from Carnersville, big sports fan. However, I believe education comes first, no matter what. I also believe that, as we've seen a lot in this young generation, that anxiety is a big problem with the young generation right now. I believe a lot of it stems from social media and the online stuff and everything. So I don't believe in doing online schooling and this and that. I don't think you learn as well as you do. I believe the classroom is best. I also am the type of person to stand up for what you believe in no matter what. You know, want to tango? Well, let's tango. But I'm right now really on the fence on whether to mask or not. I think we're being bullied politically into being masked. Just as we've highlighted, it appears, you know, the government's putting out this order out there and then directing other departments to make that decision because, well, he doesn't want to do it because it, you know, might affect his next election or whatever. So right now, I'm still on the fence. Before I came in here tonight, I was completely the other way, anti-mask. I'm like you, most of these are just pieces of cloth that you can pick up that have no filtration to them, but they call it a mask. It's technically not what I would call a mask for something of this nature. And I can understand and relate to every one of you in the audience. I'm a parent as well, so that's all I have right now.
Thanks, Jeremy. You know, I had kind of decided when we were having a meeting, I'm not here to talk about vaccines, I'm not here to talk about the benefits, how, you know, what % particles get through. I don't know that stuff. I'm a board member. I'm a social worker. I can tell you that last year I saw about an 80% increase in anxiety from students who were out of school. The failure rate, I had students that I saw in therapy that had been AB students who failed miserably the entire year. It was gut-wrenching. I just got a text today from a girl who went back to school and said, I have to come see you because she's so anxious now being back in school. She was in a different school corporation where they were out. And she's struggling now to be back with kids. She never had a problem until she was taken out of school. So I've seen the different side of all of this that doesn't have to do with masks and vaccines. It just has to do with kids being out of school and how much it impacted their mental health. And unfortunately, I think for a lot longer than just right now. I had asked Scott, and this stuff is evolving by the moment. The numbers of COVID cases in our school every day jump. So you can call today, and tomorrow he's probably going to have 10 more to add to the list or more. But I had asked him if he could prepare anything to just let you know what kind of learning loss we've had in the last, really, you were talking about the graduating class of 2020. The graduating class of 2019 really had it the worst. They had nothing.
Right.
We tried to do some things during the summer, but I know we've had some presentations, and I think Kim's going to present more to us at the next meeting about the learning loss. There's a lot of these kids that will probably spend a long, long time. This isn't just, get back in school and you'll get it all back. Our kids in poverty will have the toughest time recouping and being able to get back on track. And we're talking lifelong, possibly lifelong. So none of us are on here because we're doctors. None of us are board members because we're virologists or immunologists or researchers. Every person on this board, just from me getting to know them from being on the board, are here because they care about kids and education, or they have an interest in education and some aspect of education. That is all we care about. And if you even had a thought in your head, this is down party lines, you're wrong, because it isn't. And I'm doing a little plug that has nothing to do with any of this, that the legislature wants to change all these board members to having to be political positions as a point. We are nonpartisan. We are just in the general election, and whether you vote R, D, I, or whatever you are, you still get to vote for your school board member, whoever you want. I've worked with these folks. We have lots of different opinions. But you know what? We come together. Whether we agree or disagree, and sometimes somebody disagrees, but then we accept whatever it is that's happened, and we get along and we work together. And the one thing I want to thank every person in this room for is for being polite and kind. I have spent, as I'm sure many of my board members have, way too much time watching videos and news reports of patrons attacking board members. The most recent one was in Pennsylvania. And they surrounded the health officers' cars and the board members' cars, told them they would harass them at home. In Mount Vernon, in Indiana, board members got death threats. Brownsburg, that's where it was, Brownsburg. I consider myself a confident, aware person, and I've been nervous. Fortunately, not just tonight, and I am on social media, people have been kind to me, and I'm so grateful, because none of us wants to make these decisions. I freaking hate these masks, okay? But I wear one, and now I wear one, and I'm vaccinated, but I wear one in therapy. You have no idea how hard it is to read a person in therapy. I saw an adolescent girl for 6 times last year. She hardly talked, but she kept telling her dad, I want to come back. I want to come back. I couldn't figure out why. I was doing nothing. She got vaccinated. Last spring, I had a rule if you were vaccinated, you didn't have to wear a mask in session. She pulled that mask down, and it was magic, that session. She talked, I could see her. I don't like it either. But I want kids in school, because our kids are not learning when they're not in school. And it scares me more than just upsets me. It scares me about what's happening down the line. Our juniors, our sophomore juniors who have had 2 years of mixed results with school, and some of those kids want to go on. I mean, we've had kids that didn't complete school, that didn't finish their programming, whether it was Career Center. I know kids that went to college, they came home because they couldn't do the online learning, so now they're out of college and they're working jobs, which we know there are plenty of jobs, which is great. But it interrupted life for everybody, so let's keep our kids in school. That's all I want to do. I want to keep our kids in school. And I want to thank all of you for being so kind tonight to all of us. Because I don't think I was the only one nervous, although some of these big guys over here, they're probably like, no big deal.
Got her.
You got her to protect you. So that's just my last comment. At this point, if I read this right, I just want you to know we have so much information up here that I can't even find where we are. I think the next step is
One of these pages.
whether on our 3-page something or other, one of the 3-page papers where we look at the order of events here. So the next one is deciding if we are going to update our COVID-19 plan, which includes the most recent information from the state as our guidance, at least until the 30th. If that guidance is not continued, then we go by our matrix, if I understand that correctly. Is that everybody's understanding?
Yes. Yes.
Okay.
That's my recommendation.
That's your recommendation, okay.
I'm not exactly with you.
Okay, all right. So until September 30th,
Yep.
you got that part about the
Yeah, that's a date.
the Indiana Department of Health coming to, yes, okay, so for right now, through the 30th, if schools mask, then kids don't have to be quarantined, we can keep them in school as long as we can. After the 30th, if they remove that, we're then gonna follow this matrix that says if the building has a combined of 5% more of it, 5% or more of its students or staff with positive COVID-19, then masks will be implemented for that building. And then we followed this matrix.
I understand.
That's all I'm saying.
Okay.
That's why it says, where you asked me earlier about mask recommended. If we're not under a mandate, we go back to that we would recommend them, but if we're under a mandate, then we're requiring them.
Okay.
Okay, so everybody's clear on that. So now I will ask for a motion to approve the updated COVID-19 return to school plan.
I'll make that motion.
Thank you, Mark. Do I hear a second?
I'll second that.
Thank you, Lori. Any discussion?
Yes. So this motion only just this plan, it doesn't say we make a decision yet on whether we're masking or not.
No, I think the plan includes the governor, I don't know if we're calling it the governor, the mandate to,
Avoid quarantines.
right, that you would have to quarantine if you don't mask, that you're mandatory quarantine if you don't mask. So we are including that in our COVID-19 plan.
Till September 30th.
Till September.
So essentially, if we approve this plan,
We're mask
for the
mandating
mask mandate
for until
until
September
the
30th.
month.
In order to keep kids from being quarantined
Yes.
for 2 weeks.
Which would mean 200 and some, right now, at least 200 and some kids out of school.
And do we have an end date?
September 30th.
September 30th is when that executive order is up unless he renews it.
But what about our plan?
Our plan, then we go to this, and that's just the 2021,
Right, but does our
2022.
plan stop as well? I mean, let's say he gives the executive order extension there.
If
we
if
still
he gives
follow?
if he gives the extension, then we continue to follow the mask mandate so we can keep from quarantining. If he gets rid of the extension, there's no extended, then we follow this plan that says that if we have 5% of more students in a building, then that building goes under masks. If we have 10% or more that test positive, then we go to the hybrid. If we have 20% or more, then we go to e-learning.
So then there's still not an option for the parents to decide if their child has to wear them or not. It's not the
Not-
optional thing.
Not if the school, not if the school building has 5% or more of their students or staff.
Right,
No,
but I
then
mean,
masks are implemented for that building for a minimum of 10 calendar days.
Do we have
Right,
a,
but what I'm saying is if he drops it and it goes back, then there's no optional there. We just go directly into that one where, depending on the school.
Depending on the school and how many cases in that school, that's correct.
If we don't have 5%.
What do we have now? Do we have 5% in any building?
No, I don't.
I don't believe we do.
We
I
don't.
think
We have
We're not
3%.
even at 5%, we're about
So
3%.
no one would be in mask at with our district plan.
with current?
Really, it's
With the
where
current
there's a substantial spread. It's like Stacy was saying, if you have 50 positive cases in a school, at a size of a high school, that's a lot of positive kids at one time. But that still wouldn't kick you into that threshold of the mask. It would take,
Right.
it would be right there over 50, but we haven't hit that number. And we're in a pretty high situation now. So our hope is we won't move into that. But we have to have some sort of guidance. Where's that threshold? Working with Dr. White, what is that piece? So,
And also just that other part, I don't know, it was Jeremy or Dennis, the italicized, if a singular classroom
20%.
has over 20%, then it moves. I mean, these are all based on either a classroom or a school building, not the whole
Right,
corporation.
no, I understand that.
And the odds are, we may be back again in a month or two
Yeah.
to review these again. That's
Remember
just
how
it.
many times last year,
This
every
is-
time we had a
now.
meeting, we had new information and new guidelines.
Can
Is
I
there-
ask a question? If a parent is absolutely against their child wearing a mask, is there something as a religious exemption that can be filled out by that parent?
There are medical, if the doctors will. I know that there are
I know.
certain reasons why, but
Centerville is allowing that to happen.
I talked to our attorney and there's no religious exemption that she can find related to that. So I did talk with her about that. And she represents about 85 school districts in the state.
So we could talk to our own attorneys, I would say.
Yeah.
Yeah.
And that's why she said you can always talk to your attorney and pursue
What about
that legal.
discipline? About, like, if your child doesn't wear a mask and they're otherwise a really good standing student?
Well, that's not necessarily a board decision, that's
Yeah.
administration decision. So, we're starting here, and then admin gets to figure out how they manage that. I think Mark made a good point when I was talking to him about, being a teacher and expectations on kids, and
Kids do better than adults in most of those situations. Nobody wants to wear a mask.
Except for Chris.
It's just keep the schools open. I'm glad we started with Monica because I thought you were very honest. You don't like masks, I want my kids in school. I'm right there, 100%.
And my daughter's pretty boisterous, like I am, and has very much opinionated, but my boys, both of my boys, they're just, like you said, they're just kind of like, well, whatever, Mom. I mean, even to the point, like, I'm not happy that, Jake's going to Olivet Nazarene Christian school, and here he is, they said they didn't have to wear a mask, and now here we are, they have to wear a mask, and he has to spit in the cup once a week because he's not vaccinated. Do I like that? Absolutely not. I hate it. I hate it for him, but he's like, Mom, whatever, I'm back in class and whatever. And, sometimes that aggravates me because he's not more, but that's just how they are. And, I don't know. I'm with you guys. Like, I don't like the mask, I don't like any of that, but I don't like my kids trying to be online learning either. It's not helping them whatsoever.
But I fear too, like, what if they try to push vaccinations? We say, okay.
It's coming.
Oh, it is,
right.
We already push
Okay, so we can bully
vaccinations
them
for
into vaccinations.
10 other diseases.
You know?
There's mandates and requirements for vaccinations for a lot of other things besides COVID.
But they just said it for years and years and years and years.
Yeah, but they had
Come on now.
to, they kind of had to start someplace, and not everyone who gets one of those vaccinations for the other thing has a good outcome. You have bad outcomes with kids getting measles, mumps, and rubella. Look at a study out of Florida in 1980. They got some bad vaccine. Kids got endocrine diseases from too strong a MMR vaccine, okay? One of mine got it. He died at 32 because I gave him an MMR as I was supposed to as a parent. It was a calculated risk. It happens. There's no guarantees with anything, any kind of vaccine. You could get polio and still have a polio vaccine. People in my generation died of polio. The vaccines came out. Some people still died of polio. There's no guarantees, and it's so hard as a parent. It's so hard as a board member to try to make these decisions. We try to do what's the greater good, and the greater good is not a one-size-fits-all. It's really hard, really, really hard, but we need to keep our kids in school.
Any more discussion from the board? Jeremy or Chris, any more discussion?
No.
Okay. Okay, well, now it's time to take a vote. All those in favor of adopting the updated COVID-19 plan, please raise your hand. Okay. Opposed? Same sign? You're supposed to raise your hand if you're opposed. Thank you. Okay. Motion carries with a 4-3 vote. Okay, the next item up, Chris.
I make a motion that we adjourn.
Do I hear a second? Thank you, Dennis. All those in favor signify by raising your hand.